Let's hit it.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori La Bey, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about dementia change. We will.
Well, welcome back to Alzheimer Speaks Radio. If you enjoyed our opening music called Clarion Call by the Mark Arneson Band, you can download that now on any of your favorite music platforms. And for those of you that are new to Alzheimer Speaks Radio, we are about sound news, not just sound bites. And our goal is to raise everyone's voice, big and small, those diagnosed, those that care and serve for them, advocates, researchers, and more. Now, today we're going to be discussing COVID-19, and we have people with dementia, we have a city manager, and we have a dementia behavior specialist and gerontologist with us, as well as two communities that are going to talk about how they're adjusting. But before we go there, I just want to give a quick shout out to the Memory Cafe directory. Wonderful place to find resources. Now, they're not meeting personally right now, but many have gone online. So check out the Memory Cafe directory. And if you're looking for an exercise program, look at Live to Be Healthy. That's live, and then a number 2, and then a B and healthy. And you'll find more information about them there. Well, hello, everyone. Today we are going to do a special on COVID. I think it's just really important to hear what is going on out in the community and hear from a variety of voices, from people living with dementia to those serving them. It's going to be a really interesting conversation because we have a couple of people in senior living. We have a couple of people who are living with dementia, and we have a city manager. And then we also have a gerontologist with us today. I'm going to introduce them each quickly, and then we'll dive into our conversation. First, I want to introduce you to Keith Gallus. Keith, you've probably heard about before because he's written a book called Parental Dementia. Keith also plays a huge role. He's a regional director with the senior communities, and so he has a really good idea of what's going on and what needs to be done and how it's affecting their communities as a whole. So I just want to welcome you to the show today. How are you doing, Keith?
Hi, Lori. Thank you so much for having me on the show.
Great. Thanks for joining us. Next, I'm just going to introduce Kate Lau. Kate has been living with dementia, and she is a wonderful advocate. She does a lot of work with administrating various chat rooms and stuff on Facebook and is very involved. So welcome, Kate. How are you doing today?
Doing great.
Wonderful. Thanks. And we also have with us Deb Bite, though she is not on camera. And she also works in a senior living. She's an executive director for Oak Meadows. So welcome to the show.
Thank you, Lori. I'm happy to be here.
Thank you. Next, I want to just introduce Pat Trudgeon. Pat, I've had the opportunity to work with for many years. He's the city manager of Roseville, Minnesota, and he has been a wonderful dementia advocate and helped us with our dementia-friendly community there. So welcome, Pat. How are you doing?
Thank you, Lori. Thanks for having me on. I'm looking forward to the conversation.
Thanks for taking the time. Next, I want to introduce Lisa Head. Lisa is also living with dementia, and she has a very unique role because she's a retired teacher, and she has, if I believe I'm correct, 3 young ones at home. So welcome, Lisa.
Thank you for having me. And that's true. They're not young ones anymore. They're 16, 14, and 12.
Well, compared to me, they're young.
Yeah.
So, they're still kids and still a handful, I'm sure.
Oh, teenagers. Yeah.
Yep. Wonderful. And then last but not least, Alon Caspi. Alon Caspi, I've known for years now. He's a gerontologist and a dementia behavioral specialist. He also helps me co-facilitate the dementia chats we do. So welcome, Alon.
Hello, everyone. Thanks for doing it, Lori.
Wonderful. I'm going to start out and have Keith talk first because he's on a tight schedule, but was able to take time to be with us. So Keith, if you don't mind telling us how are things in the senior communities, and from the people living there to your staff and to the families, how's everybody coping?
Well, it hasn't been easy, but we're good. None of our communities have anyone positive, which is a blessing. We're doing everything that the CDC tells us to do. The thing about assisted living, memory cares, we follow directions. We do what we're told, and we're doing everything possible. What happened when the CDC came out and said, this virus can have an incubation period of 14 days, and then when it also said that it can live on surfaces longer than 24 hours, that kind of changed everything, and that's really what caused everyone to go into quarantine. And really what I want to tell your listeners and families that have loved ones in memory care and assisted living and whatnot, what the executive directors are trying to do and what everyone in the community is trying to do is try to keep the outside world from coming in and trying to keep that virus out of the community. So even though it sounds terrible and it's heartbreaking, I listened to your last show, and she had a family member that's in assisted living, and she understood that she needed to stay out. It's heartbreaking, but all I can tell you is the best thing for our seniors right now is to stay out of the buildings, stay away, stay at home, wash your hands, try not to touch your face, keep that 6 foot, and just be safe. It is really the best thing we can do right now until we know what's going on. Many of communities, and you'll probably talk about this soon, is shelter in place orders have been put in here in Georgia. Many counties are shelter in place. We're able to get to the communities because we're essential healthcare personnel, and we have badges and whatnot to get through barricades if that ever happens. So your loved ones are still going to be taken care of no matter what. We have tremendous caregivers and nurses that show up every day. It's awesome that they do that, and our residents are just getting fantastic care. One of the things that we did find out, though, because we no longer have entertainers come in, we no longer have a lot of support that we used to have, whether it was beauty salons and those type of things. We found that one of our housekeepers is a great stylist and can do hair. And one of our cooks have a beautiful singing voice that goes up and down the hallways, and the residents love it. So some things that are really awesome have come out of this. And the trick is to get the community to come together as a family and just get through this. And that's what I see what's happening in most of our communities.
So a question for you, as far as, are you guys able to access the protective gear that is in such shortage, or so everyone is saying, throughout the country? How is that being dealt with?
Lori, this isn't a political show, so I have to be careful what I say. The PPEs right now, we're good. Masks are short. I have a keg of, a literal keg of sanitizer coming to me. So yes, masks and those type of things. Most PPEs we have, but there is a national shortage of masks. But currently at most of our locations, that's not an issue.
Okay, I know here in Minnesota, they had said the handmade mask, a lot of people were wearing those and give those to the grocery stores and the gas stations and the other essentials. Is that something you guys would be interested in having as the additional protection at all, or?
Ideally, I can't really talk too much on that.
Okay.
Right now, we have what we have, and we have more coming. That's really all I can speak on at this time.
Okay. And then is there a difference in terms of, and I should clarify with your community, what levels of care do you have? Do you have assisted living? Do you have memory care? And is there a difference in terms of how those are being served? Because many are saying, you can't just tell somebody in memory care to stay in their room. That doesn't always work. So how's that being handled?
You are right. The memory care units, the one good thing is that memory care units, no one's coming in or out. And it takes a code to get into a community. So it's already set up to where, the nurse practitioners come in, a dentist will come in. There's really no reason to go out other than if there's an extreme emergency of some sort. Everything is going just fine in the memory cares. And actually, in some respects, it might be a little bit easier because they're already set up to do that. In assisted living, it's a little bit different. The doors are locked, but it doesn't mean that a resident can't open it up for somebody, which, I had reports early on when we first started this, but there's only so much I can talk about, Lori, when it comes to that. But overall, I'm very proud of the communities that I represent. But what I would ask is keep the caregivers and the nurses in your prayers. Think about them. Just be safe out there. That's all you can do at this time.
Okay. Do you have time for one more question in terms of how you're communicating with families at all?
Sure. One of the heartbreaking things, obviously, is that you can't make physical contact with your loved one. So for the first week that we were on quarantine, I spent from 8 o'clock to 8 a.m. to 8 p.m. pretty much on the phone with family members, telling them what's going on and whatnot, and how their family members are going to be cared for. The phone still works. People have my cell phone. They have the number here. We talk to families all the time. But, I bought a washable laptop for the community I'm talking in right now, so they can get together on Skype or Zoom like we are right now. Everyone has a phone, so there's that opportunity for, FaceTiming and whatever they want to use. So there are still those ways to communicate. Everything you see on Facebook and Instagram, people coming to the door, people making signs, standing outside singing, all those things are going on, and it's beautiful in some respects and heartbreaking in others. But there's all that type of communication is still happening. The unfortunate thing with a lot of memory cares is that a lot of memory cares are designed where you can't look outside, so that you don't have that exit seeking urge. So that's hard. And that's kind of the hard part about it, where you really have to do the Skype or the Zoom to be able to have that connection still.
Wonderful. Well, thanks for taking the time with us.
Love the show, and thank you, and be safe out there.
Okay, thank you. Bye now.
Bye-bye.
I'm going to go to Lisa next. Lisa, can you tell us a little bit about how you're adjusting in your family to life with COVID?
Well, as far as I go, not a whole lot has changed as far as not getting out much. But the boys have been home since the middle of March, and it was just announced yesterday that they will not be going back this year. And so we are here for we don't know how long. They're supposed to lift the quarantine tomorrow, and the governor's going to speak today on that. And not tomorrow, on Tuesday. And I'm really thinking that that's not going to happen. And
can you remind us what state you're in, Lisa?
I'm in Indiana.
Okay.
And ours is still going up, so we won't be, I'm sure we won't be released out of quarantine for a while. I have groceries delivered. I do have to go out for appointments, but I've noticed in a good way is that I used to be a band director and music teacher, so I'm kind of an artsy type person. And what I've noticed, like at my house, I have two sons that have started their own businesses, and one is centered around the virus, and he's doing very well, actually.
Give a plug for it. I love what they're doing. So.
Yes, he and a friend he was talking to that lives in Oregon, I believe. Seems like it. Anyway, they were coming up with ideas for sweatshirts, hoodies, and what they'd have on there. And so she came up with the emblem that I sent you, and it's called Quarantines with the TEENS, and they have they have socks and all kinds of things, and talks about social distancing, and there's just all kinds of them.
Yeah, they have some pretty cute sayings. Well, that's great. So as far as you had mentioned that you're going to appointments and stuff, have those cut back? Because I know here in Minnesota, anything that's not critical, stay away.
Yes. Yeah, there's only one type we go to appointments, and I had to go pick up some medication yesterday, and there were more people out than usual.
Yeah.
When there's not a quarantine, so nobody's listening. It's not being enforced. But like Kim said earlier, let's not get political about it. But we're not heeding the warnings very well, and so I'm making my kids stay home.
I know my granddaughter has therapy sessions, and she's doing that over video conference now, which is really helping her stay connected. Now, you also do your YouTube channel. Why don't you tell people about that? Because they might want to check that out and subscribe as well.
Okay, I have a YouTube channel that's called Living Life with Lisa, and it's about basically my life and how I get through each day with chronic illness. I have several of them, and early onset dementia is one of them. Sometimes we talk about dementia, sometimes we don't, sometimes it's just stories. It started out as my wanting to have a record so that when I got to the point where I didn't have a voice anymore, my boys could look back and see and have memories, and I could have memories listed. And I'll tell you, I do recipes a couple of times, and it's a good thing because I went to make one of them yesterday and I could not remember any of the ingredients or any of the instructions. And so I actually had to go on my YouTube side and watch myself make it so I knew how to make what I was making.
That's great, though. That's great. How are the boys, overall adjusting to not being able to be with their friends? Are they connected enough technology-wise?
Yes. There's a young man here that does not belong to me, but he's kind of like Norm from Cheers. He walks in the house and has a suitcase and a TV under his arm and says, hi, and I say hi, and he goes down the basement, and then I don't see him until he walks out. And sometimes that's a weekend, sometimes that's weeks. So he's my other son, but he's here, and so that's helping because the two older ones like to play video games with him. They don't have to play with just each other. The youngest one, he was born for this. He's perfectly content with sitting on the couch and not doing anything all day long. So they're handling it very well. Little middle one is antsy. The governor did leave the state parks open, and they're free now because of the quarantine, and they want to go fishing. And I did take them once, and it was really nice because we only live about 8 miles from State Park. And so went over there, and there's no people. They're not going to get it from the trees or the grass. And they fished all day and had a good time. And I went and picked them up. So we don't actually we can go outside the building. He's reiterated it yesterday in his announcement that he wanted people to use the state parks if they were near them.
Wonderful. That's great. I know with some of ours, they've had problems with too many people congregating too close, and making some changes there. But thank you for taking time to be with us, Lisa. Mm-hmm. I'm going to throw it over to Pat here next. As I mentioned, Pat is the city manager for Roseville, Minnesota. And I thought it would be really interesting to find out, how does the city adjust to all these changes? Because I would imagine you guys are going through massive changes and just trying to keep up with all the rule and regulation changes rolling out as well, Pat.
Yes, Lori, it's been quite interesting the last several weeks in just trying to adjust. It seemed for a while the news was coming so fast and furious and trying to adjust. And being a public-facing agency, we really want to make sure we're accessible for people for their basic needs and just for other needs as well. And we've had to close our buildings and our facilities to the public really since the beginning of March. I think it was by mid-March for sure. And currently we're pretty much operating with people working from home. Police and firefighters are still out there, and our maintenance workers. Things still happen. Water mains break. If we get snow here, we'll need to plow the streets and stuff. So we're trying to keep it as normal as possible, but it's certainly something that's really changed the dynamics on our services. And we've had to get kind of thrown into the deep end as far as technology and trying to work from home and how do we make ourselves still accessible. Even some things such as city council meetings where people gather and the public can come and talk to us. We're going to be doing that more and more remotely, and that just counter to kind of our ethics here and trying to make sure it's accessible to everybody. I think one thing that we as cities are prepared, and we're no different than the other cities, for emergencies and disasters, but when we think of those, it's often a tornado or a flood or something like that. And this one is certainly very, very unique. We do go through a lot of training, but this is something that really we haven't gamed out in the sense of trying to understand how we would do stuff. So we've been able to quite quickly kind of pivot and use some of our skills and just kind of figure it out as we go. One of the challenges with this is that it's so widespread and everybody's affected. And if you think of a tornado where one community might get hit, other communities can help and rally and help that community, but we're all facing the same issues. And the other thing, the natural reaction to a disaster is to gather and help, but we can't gather physically together. And so that proves some challenges as well. So that's one of the unique differences. The city of Roseville itself does not provide direct social services. That's through our county, Ramsey County. But we do have a very strong community-based movement here in regards to community health. And one of them you've been involved with, Lori's Roseville Alzheimer and Dementia group, where for the past several years, we've really been out there advocating, providing resources, providing speakers, making connections for people to talk and understand what their options are. And at the heart of that is about people gathering and talking through and providing respite care, providing opportunities for people that are suffering Alzheimer's and dementia to gather and come together. That's not possible right now. So it's really, I can just imagine a struggle for people to try to sort that out and how to best do that here. And so we're trying to do what we can. As I said, we're not a direct provider of those, so we're not as impacted as Keith was in trying to deal with families. But we are concerned about that. We want to make sure in our community we can help people the best way we can and provide resources and point them in the right direction. And that's where people like yourself, Lori, are active in the community that have those resources and make those connections is really, really important.
Thank you. How are your police and fire? Have you had any COVID within, your staffing and stuff there? Because we're hearing that on the news, especially like out in New York, how many people are affected and...
Yeah, so far, nothing that has come back positive. We're, of course, being very sensitive to any illness, just like any other person. And if you can just imagine that if a police officer or a firefighter is positive with that and passes it along, you can wipe out a whole shift and really undermine the ability to serve the public here. So we're trying to be extra careful on that. And we do have PPE, and we try to use that as much as possible. But there's situations, especially on the police side, where if you're just responding to people that are inebriated and need to break it up, and then all of a sudden it turns out one of them is sick, and you're not properly prepared, that's going to be a problem. Our firefighters, of course, are prepared as they respond to medicals, and actually now Ramsey County, which is my county, is when they dispatch, they'll have a little warning or statement about this is a pandemic response, COVID response, so we can be really prepared for that. So we're starting to see some of those calls come in as we do, but yeah, they have to be very protected, and yet they still need to serve. The men and women in those lines of work are very dedicated to public service, so they're more than willing to do that, but at the same time, they have to be careful themselves, just for their personal health and their family's health, and just having the ability to continue to serve here. So, my hat's off to them, that they're out there every day trying to protect everybody. Because real life goes on beyond just COVID. Other things happen, unfortunately, and we have to be ready for that. And we want to make sure we can always respond in a timely manner, and not be so decimated by COVID and the illness that we can't respond.
I'm just wondering, I'm thinking of these face masks, and you've got so many people out there making them, and I know that they don't meet the standards, but would it be helpful for police and fire to have those and pass them out to people they're talking to? Because they say that it protects from spreading. Would that be something that you'd consider? Or, I mean, and maybe that's not something you can decide. There's so many levels to all this, but it just seems like there's so many people that want to help, and there's a lot of these resources. And then how do you get them into community hands if, because they're talking about maybe everyone is going to be mandated to wear one, and how do people get a hold of those? And would that be another way to maybe spread them around?
Yeah, so we have been contacted by a lot of people, and I cannot begin to even talk about whether it's cloth masks are going to help or not, and that's for somebody else to decide here. But to the extent that people feel that they want to contribute, we can certainly take those in. Our first responders are certainly going to have the N95 masks and that stuff, and that's what they'll need to use. But there might, to your point, Lori, there might be other people in the community that may need to have these masks if the guidance changes, and that's something as a community, as a city, we can help distribute and things like that. But I know we have gotten calls from people asking to donate, and even if we don't directly need them, we can certainly help facilitate transfer to somebody else that does, if they would like us to help.
Yeah, because I was even thinking with, I went to Costco the other day, and I had my mask and my gloves. I got off self-isolation, and I hadn't really been out in public, and it was like, no one's wearing them. And I was like shocked. The staff there weren't. And I just thought, even if they had a mask because nobody knows who's positive or not, and maybe that would help a little bit in terms of downing the spread. But again, I'm no Dr. Fauci, and he, he seems to have a good handle on all this, but we are hearing more and more about this invisible disease, and the more that we can keep covered, the less we'll be able to spread in case we are contagious and stuff. Can I ask how morale is doing with all of this?
Right. So I did talk to both chiefs on that, and it seems like the frontline officers are doing well. They're doing their jobs. As I said, they are very committed to public service. I think there, of course, is worry about how it could impact their family and bringing it back. Not to get too deep into the woods here, but there's some, concern about workers' compensation. If they do get COVID during this, are they protected? And the traditional system doesn't necessarily think about a pandemic, these things. So actually in the state of Minnesota, they're looking to change some regulations. And I think that would give them a great peace of mind, so they can go about and do their work and know that if they do come down with it and they have serious complications, that they will be financially protected as well as health protected, and making sure that they can still function, and that'll give them and their families a peace of mind as they continue to do their job.
Which I think is smart. I mean, you think of all the guys and the men and women who, were in the midst of 9/11 and how they had to fight, for that. That's just so emotionally exhausting, on top of not feeling well. Nobody needs to go through that. We need to honor people in a better fashion. I think there'll be a lot of good changes that come out of this in a really difficult situation, but I think there's a lot of creativity, and we're seeing how some cost factors can be brought down, and the manufacturing piece is, I think, going to be pulled back home. I mean, I think there's just a lot of things that are going to be looked at differently, including healthcare on a whole, and how we communicate. And I'm just thrilled we're all able to connect. I was worried about the internet being able to hold all of the numbers of people that are now on this and doing things. One woman, Cam, was supposed to join us today, but in Colorado, she says it's not stable right here. She couldn't even do a call in. She says it's just not working. So well, I thank you so much for taking the time to be with us, Pat. It's really interesting to get the city's perspective. We're getting the national, and then we're getting kind of the government. And then when I'm talking with, like our state perspective, but I've been talking with a lot of others, and they're like, oh, we don't even listen to the state, and we're just focusing on what our local is saying. So everybody's communicating a little bit different on what's going on, and it is hard to sort through it all. It gets very confusing with what we should do and when we should do it. So again, thank you for the time. I'm going to pull Deb in next. And Deb, again, is
Hi.
with senior housing with Oak Meadows. Can you just tell people the type of services that you have, and then how you are adjusting to all of this this virus stuff we're going through?
I sure can. Adjusting, that's a really unique word right now. We have at Oak Meadows assisted living, memory care, and independent living, and which is most unique during this time because we have put into place sheltering in place for everybody in their apartments. We aren't allowing visitors. We are restricting as many people as possible coming into the building. And for people in independent living, that's really been a challenge. That's been hard for them because they can't quite understand why they can't just, go out and visit with all their friends down the hall because nobody's sick here. So why can't we just do it? But, we just really feel that it's most beneficial to try and abide by these restrictions as much as possible so we can keep our tenants healthy. And adjusting is definitely not easy. I think our staff have adjusted beautifully. They have really settled into a unusual new normal with grace and amazing talent. Our activities department has come up with, whatever they can think of to do activities, from a hallway perspective to dropping little notes and fun pictures into every single tenant's apartment and outside their door, and whatever they can figure out so that we can stay connected with every single tenant. Dining room is delivering all our meals to every individual apartment. So it's been a big adjustment, there's no question, but I think amazingly the staff have done incredible, and I think a lot of us feel very blessed that we are essential staff and that we are here and that we aren't laid off staff, because there are so many people that have lost their jobs. So we all come to work just feeling pretty blessed.
Well, that's great. I've seen some of the stuff on Facebook, with the hall things that you're doing. Have you tapped in, Keith had mentioned that a lot of their people, their entertainment and stuff, hasn't been able to come in. Have you flipped any of that into technology where they can still, I've seen some where one place had a robot going down the hall with the guy singing on it. And I know not every place has a robot that can do that, but I'm just wondering, I've seen people roll in TVs to be able to down the hall, and they're doing sing-alongs and things like that.
That's the robot idea is really cool. That might be our next thing. But right now, we actually are pretty excited because as of this week, we got a new system installed very rapidly. We begged for it as fast as we could so that we could have an additional channel on their TVs, so we can send them through this channel. We can have recorded concerts that we have some of our musicians are sending to us, and we can show those on this internal station. We can do our exercise program every day. We can now do our worship services, so they can actually watch them on this internal channel. So we're pretty excited about just implementing that this week. Not having a robot, it's just us staff doing the concerts. So on Fridays, we've been going up and down all of the halls and either doing line dancing or singing, and all of the tenants just come to their doors and join in, and I think they get a kick out of it. So we're just trying to be creative in how we're staying connected individually to every person without, having large group activities, but making sure that we're checking in on them and knowing they're okay, and also engaging them in something fun. And we're also doing Skyping.
Okay.
A lot of Skyping.
Wonderful. I was wondering if, because I have a friend who is gathering people to kind of do pen pal stuff and just to get letters written to people within a community, just so that they have something from the outside. Now, needless to say, when those are dropped off, they probably have to be set aside for a couple days to make sure there's no germs and stuff on it. But is that something that families should be considering doing? Is that more work, for you guys? Is it advantageous for the people to get some of those personal notes? What are your thoughts on something like that?
I think they would be fantastic. We've had several daycares call us and ask us if the children could draw pictures, and we said absolutely. So anybody that would want to do letters or notes or little things that can go to the tenants would be wonderful. We right away when we started our self-sheltering in place, we hung a bag on everybody's door, and that's where we deliver mail every day and deliver treats and deliver fun things. So we are going around to all the apartments every single day delivering something, and to put in a note or a fun picture or something from other people would be great. They would love it.
Okay, so for those of you listening, reach out to communities in your area. I think that would be a wonderful idea, and it gives other people, an idea of what to, something to do, because a lot of people feel hopeless. They want to help, and like Pat mentioned, you can't gather in groups, but this is something we could do as individuals and help people along with that. For sure. How are you guys for protective gear?
Well, that's also a good question. I did place an order for masks for, we contract our home care with Ebenezer, so Ebenezer is delivering masks to our home care and nursing staff, but our Oak Meadows staff, I had to order separately, and of course they have not come in. So I have been blessed to have, we had a garden club that made homemade masks for us. I have a dear friend that made a bunch of masks. I have my soon-to-be daughter-in-law's mom has made us almost 30 masks. So right now, all of our staff have one homemade mask that they can wash and reuse. And that's been super helpful. We can always use more, but at least we know we've been able to get all of our staff at least one mask that they can reuse.
Well, and again, I think that's great. If it can detour, anything at all, I think it's worth it for people to utilize those.
Absolutely.
I was going to mention to you with your private channel, maybe you're using these guys already, but Live to Be Healthy used to go into communities and do exercise and fitness programs, and they're doing live streaming now too. If you need another one in there, but it's just Live and then the number 2 and the letter B and then Healthy. And so
yeah, I know of them. I will give that to Megan. That's good to know.
Yeah, that might even be cool for the community channels to tap into. I didn't even think of that for some of the cable channels to tap into.
Definitely.
For people. Well, thank you so much for taking care of our elders and staying connected to families and being proactive with all of this. And really, I just honor everybody's efforts in this immensely, and so really appreciate it very much. I'm going to go to Kate next, and we'll learn how Kate is adjusting to life with COVID.
Well, doing good. I think I had the flu like a few weeks ago, so I self-quarantined, just to be safe. And there's only 2 of us in the house, and I told my husband that, tell me when you're getting out of the kitchen so I can go in. We do little things like that, and it worked. And everything's fine. We live just a little bit outside of the campus of the University of Illinois. It's very quiet. I don't see students. I don't see a lot of people walking. This is a very nice area with lots of trees, and people love to walk around here. I don't see people walking their dogs. And I mean, like, well, every now and then when I walk my dog, I see a person on the other street. This whole place, I think a month ago when somebody called me and said, well, there's no more toilet paper at Walmart. That's like that's the wake up call, you know. At first I thought, oh, it's somewhere there, you know. It's like, why do people go and buy all the toilet paper? You know, it's like, okay, is this supposed to be very serious? So they said, yes. So I called Walmart to deliver my stuff. Of course, the delivery line was so busy. You know, it's easier to just go out to a store close to us. So at that time, there were no masks yet. Nobody were wearing masks. So I was very surprised at the number of people out there. Yet the street where you drive through, ghost town, not a thing. It's silent. There's nobody out, but there are people out at the store buying massive tons of toilet paper, of course, and water. I went to get some meats, and but I've got a lot of canned food, and I was kind of scared of getting produce. So I went and bought frozen vegetables, and I heard from my friends that they're doing the same thing. It's good to have an extra freezer in this kind of situation, because my whole fridge cannot hold that. But I can actually, I think, open a small store when it comes to canned food, especially for veggies and beans and protein stuff. So this is an advertisement to tell you guys what I have, and if you need anything, and I can help you. I've got tons of green beans. So we're okay. We're staying here. It is for us, people with dementia. Okay, I've talked to quite a few of them. They say that for us, it's very little change. Nobody comes and see us. We have dementia. We're isolated. And for me, it's not a really big change, other than now you got to talk to your grandchildren, on Skype or, or on your iPhone and see them play and stuff like that. And you can just go there and pick them up and hug them. That I want to do,
Are you seeing more connection with your family now that now that the isolation isn't just affecting you as a person with dementia, but it's affecting everyone? Are you seeing an increase in family and friend connections at all?
Yes, I think family, because my son's girlfriend, or soon to be my daughter-in-law, she came here and brought food for us. And she came here and helped me vacuum and steam my carpet. Oh my goodness, that's such a gift, because I have severe spinal stenosis, and I had a muscle spasm about 2 weeks ago, and I could not walk. I'm just totally non-weight bearing. So I rolled myself off the love seat that I was sitting at, and had to grab a utility cart, the closest thing that would help me walk to my walker. So I used the utility cart to my walker, and then onto the walker. My goodness, the pain was so excruciating. I said, I'm going to sit on this walker, but I couldn't even turn around, and sit or anything. And I just lived like that until like the next day I had to go to see the doctor, managed to get into the clinic to be seen, and that's taken care of. So, yeah.
Well, so like with doctor's appointments, are you more nervous of going in, or when the pain's just that bad, it's just like, I don't care, I'm going to the doctor?
For that one, I did not care. And, your breathing gets so, I had shortness of breath because of the pain, and you just don't breathe right, and your stomach feel all like distended. So I've got to remember, keep your mouth shut and breathe this way. But by the time I got to the clinic, I was trying to not breathe, and that was really hurting me worse because there's so many people without mask. The only thing they asked was, do you have a cough? If you have a cough, you cannot go in. I went like, no, I don't have a cough. Thank goodness. Now I can go in. So my back could be, adjusted or whatever. I'm very, okay, I'll just say it. I'm germophobic. So the breathing thing is very, very scary for me that I would get, some of the virus.
I can imagine that. And the fear, I remember I was out in New Jersey and I was on my way back home to Minnesota, and I was in the airport and I coughed, and everyone is trying to suppress coughs or sneezes. I mean, no, because everyone's head just snaps and turns, and there was this one woman a row over from me at the gate who was probably in her 80s, and she had a face mask, and so did her care partner. And I coughed and her head snapped all the way around. I don't know how it did break off. And her eyes were so filled with fear, and I felt horrible. And I just wanted to go over and go, really, I'm okay. And I didn't dare do that because I knew that would cause her more fear. But I felt horrible. And, I came home, I self-isolated, and, I didn't have any symptoms. But was I a carrier? I don't know. But I did have a mask on by then and things, but it was just, it's just petrifying for some people, especially if they have some other illnesses and things. Now, Kate, you're still,
Lori, I was very surprised at the number of people that still go to the store. I go to the store. I need to eat. I'm not going to be so fearful that, I can't go outside. Use your common sense. But to bring little babies and children, infants, to the store, to the grocery store, well, that's totally not wise.
Yeah. So, my neighbor said that the other day, because his wife works at a large grocery store, and she's like, I don't get it. And I'm like, a lot of people live alone and they don't have a choice. They can't leave their little ones in the car or at home, or they can't bring them over to anyone else. And
that's true.
And so, we have to consider maybe that's their situation. Hopefully that's their situation and they're not doing it,
I was a little judgmental because there's dad and mom. One can stay home,
Yep. Not everybody's got a dad and a mom, though, not in this day. So
yeah. Dad and mom and 3 kids. And I went like, oh no, and of course that little kids, they don't want to wear mask. I mean, which little kid wants to wear mask?
No, they got to be fun. They'd have to be some kind of character thing or something.
Spider-Man,
Yep.
Batman mask.
Yeah. Exactly. Well, I'm going to get on to Elon and see, how all this has been affecting you and in your business as a gerontologist and a dementia behavior specialist.
Well, first, I'm just appreciative that you're holding this conversation. Just interesting to listen to the different perspectives. The people that are, all of you today. For me, it all feels kind of in flux. We have 2 young girls at home. One is 1.5-year-old and one is 5. And my wife and I are just trying to, adjust by working around that. So, we split the day in a certain way so that my wife will work part of the day, and then we switch so that she will be with the girls. And we're just adjusting to a new normal here with our family. And I don't know, I was just taking in and listening to the things you shared. At the same time, I do feel, we're always inspired by stories, innovation and people who see the opportunity in a most positive way. To help people, and those stories kind of uplifting. But So, one of the things that we were dealing here in Minnesota is, as of a couple of days ago, we had 11 of the 17. Now there's more people dead here in Minnesota due to the coronavirus. But we had 11 out of 17. I believe it's 65% of the people who died due to the virus were living in long-term care homes. We've seen that 11 out of the 17 deaths in Minnesota were of people living in long-term care homes, older adults. And there were different organizations, including Elder Voice Family Advocates here, that there was a strong need to know what those communities are. And that came from different reasons, but one of them is we've seen in different countries mobilization of resources, of knowledge, of emotional support, of innovation, donations. And, we think that assisted livings and nursing homes, they don't operate in a vacuum. They don't, they're embedded, they're deeply embedded in their communities. And you have nurses and nurse aides coming in and coming out to their families. So we have to think, number one, about older adults with underlying conditions, but there's also the community that is being impacted. So in any case, there's this discussion here in Minnesota, debate here in Minnesota. And after a few weeks that the Department of Health did not release the names of the nursing homes and assisted living, after mounting pressure from different stakeholder groups here, the Commissioner of Health announced yesterday that they will release the names of those settings where there are residents with, and possibly also staff with confirmed COVID-19, not their names, of course, just the names of the long-term care settings. And there's different reasons for that. But in any case, that's just one of the things that we've been engaged. And this was yesterday in the Star Tribune. And I think that tomorrow, we weren't sure if it's to be today or tomorrow, but now the latest I heard is that tomorrow, Saturday, the Department of State, the Minnesota Department of Health, will release the name of those long-term care settings. And I'm just, there's implications for that, and there's ethical consideration, there's possible privacy issues.
Okay, well, and I think that is it is wonderful that is happening. I know I had a debate with a bunch of girlfriends in healthcare, and they're like, "Oh, they can't do that," and I'm like, I think the public does have a right to know. Families have a right to know what's what. But then it brings up the question of many people are wondering, do I pull somebody out of the care that they're receiving? And I would love to hear Deb's insight on this. My thought is most people, if they moved into a community, they moved in for a reason. They needed some assistance there. So Deb, what are your thoughts? Because you're in that environment.
That's really a good question, Lori. And it's interesting because yesterday I read an article that talked exactly about that. Should families take their loved ones out of a senior living community, would they be safer? And there's so much that we're able to do here and to help protect people here that, it's a tough question because it's personal. Some people are going to feel different about it than others. I think most of our tenants that are here are feeling that they are safe and they are protected, and so they don't want to leave. This is their home. This is where they want to be. Now we do have a couple tenants that their families have brought them to stay with them during this time, and they just feel that offers them that family, that loved one immediate connection, because that's the hard part, is not being able to have that face-to-face connection with families. But I would say that all of our tenants that are here that we talk to this is where they want to be. They want to stay here. This is home. This is where they're comfortable. So having people be where they're comfortable and feel safe and cared for is what's important. It's also hard for families with some people to be able to meet their care needs. It's that would put a lot of burden on some families because some of their cares would be pretty challenging for some people to be able to do at home.
Well, and from what a family sees when somebody's living in community versus what, sees as far as skill set and day-to-day operations, it can be very, very different.
Absolutely.
And I'm sure Kate, and I'm going to unmute Kate and Lisa on this as well, because you guys talk about, hey, how you guys even get bullied because you show up and you'll look fine, you don't have dementia and all of those types of things. So things can look okay, but not necessarily be what you perceive them to be. And I think sometimes families will fall in the trap of guilt, and this is what they should do, but they also have to really evaluate again. If someone's in independent living, it's probably much different than if someone's in memory care, in terms of needs. And if it was a situation where they moved because they needed more care, to pull them back, it can be confusing for many people, and even people who are in independent and in assisted living. I hear from people all around saying, well, probably 80% of their population has some form of dementia, and so it might be slight, but those changes in routine, those significant moves can increase those things too and cause more confusion. And I think we do have to look at what is their comfort, what is their environment. In one article I read, one woman, was really happy. She says, I this is my home. This is, if I'm going to die, this is where I want to be. This is my home now, and they're also worried about, well, what if I'm a carrier and I bring that, to my family, or vice versa. I mean, there's so many levels of unknown, especially when we can't all get tested in order to even help us make a sound decision in terms of what we're dealing with, on top of just the physical and mental and emotional situation. Elon, and then I'll go to Kate and Lisa.
So Deb, I was wondering if you would be willing to share your thoughts about those assisted livings or nursing homes where there are confirmed COVID-19, residents with COVID-19 or staff. What are your thoughts about whether or not to share that information?
That's a really good question, because coming from a position where if we were one of those communities, would we want the entire public to know? I guess there's a part of me that as a leader at a community, I want to know who the other ones are, but as a leader at a community, I also wouldn't necessarily want the entire public to know. So I wish there was a way to share it kind of internally, if I might say, to other senior living communities versus the entire public. I don't know if that even makes sense, but I understand people want to know, but I also understand the ramifications can be, to those communities, may be just huge. I think about that nursing home in Washington that lost so many residents. How are they ever going to recover from that? It might be impossible. So it's kind of a double-edged sword. I understand why people want to know. I think for us, if we did have a positive case, hopefully we never will, we would, of course, let all of our tenants and families know. But that doesn't mean I would necessarily want the entire public to know.
Yeah, and I get that, but I also get the other side, because some staff work in more than one community too, and that, right. And so having that inner workings amongst you makes some sense too. But then I also think that by letting the public know, and I think a lot of education needs to be done, because it's not like any community did anything wrong. This doesn't care who it attacks, how it attacks. But I think by having the public understand, I'm hoping that in the future, it will put things in place to make everybody safer so that we can reduce this and that we have better systems in. Maybe even like with the flu, we lose a lot of people every year from the flu, and people are contained in their homes. Maybe we're getting to the point where they have to be moved or isolated to not infect more people. And and even with admissions now, my thought is, and I would love your opinion on this too, is should we still allow admissions because we don't know without them being tested? Or does somebody have to move in someplace temporarily so they're safe to move into your community, which is really a juggling act. And then also for somebody with memory care would be much more traumatic, but would it be safer for the overall community?
Well, I agree that having people move in at this point, I think, should really just be emergency move-ins only. And people that can wait, I think, should wait, just because it goes both ways. I mean, we don't know where all they've been, and right now we're doing well, so we want to keep it that way. So the less people we bring into our building, the better our odds are of keeping us healthy and safe. So I think obviously emergency move-ins are still going to happen, and emergency move-outs. We have people that pass away, so that requires people coming in, and so there's life still happens in our buildings to a degree. And so how do we juggle that, and how do we make sure that we keep everyone safe when anyone that comes to our building has to be wellness screened, wear a mask? So I think move-ins are definitely a big challenge right now, that they should be more emergency-related move-ins only. That's just my personal opinion.
Yeah, I saw some, I can't even remember what state, but one nursing, I think it was a nursing home, was converting to just be COVID patients only. And who knows, and maybe it was Washington that had it, to start with. I don't know. But they're looking at so many different alternatives, but I think there's got to be a way to make things safe. I was talking with a friend of mine who she does tours, and she says they've gone to virtual tours and they screen everybody by phone. They'll allow one family member to come and physically look, but they take their temperature, they wear gloves, they wear masks, they're told they will go in and out in 5 minutes. They're not to touch anything or to talk to anybody. And she said she's still surprised how many people want to do that at this stage of the game. And she said she went from probably being one of the most liked people to the one most despised employee, because they're fearful of outsiders coming in with all of this. And is that going to endanger them? And I really think that I think the states and the federal government need to look really closely at not only the physical possibility, but the emotional stress that it's adding to staff that are exhausted and worried to begin with, and residents, to help reduce that. Because stress does nasty things to people and their bodies, and we have to be really, really careful with that. Kate, what are your thoughts on all of this?
My son works for a hospital here, and of course there's patients that has the virus, and I do worry about him, but they're all masked and gloved. And one thing I do both worry me is like they don't put anything on their shoes, because shoes can contaminate too, So just gloves and mask. And so first thing I told him was, my goodness, you've got little children, so you need to do something about changing your clothes or washing your hands before you get inside the house. So this is funny. So he's got to go to the garage, change everything, shoes and all, because like I said, there's none of those protective cover for the shoes. So everything from head to toe, he would just take everything off in the garage, walk into the house, and take a quick hot shower. That way he didn't bring anything in. Hopefully, so far it's been working. And I have a son in DC. He's also an essential worker. So when he comes home, his wife called me. He said, you know what I do? I told him, go to the bathroom, wash your hands, because she wanted to get hold of his wallet, his keys, in case he said no. So she stopped him right there and said, give me your wallet and everything. And then he would go to the bathroom and she would start taking all the wipes on the doorknobs. I do the same thing, doorknobs, and clean his wallet and his keys. And, I want this to be over because there's so many changes in our lives. I just say that, we just live our life like we do. But I think emotionally, it still affects us, not only mentally. My husband has cancer, and I want to make sure that, he doesn't go around many people. But I have FTD. So I want to go someplace, and if I'm caught driving with my FTD on my medical chart, no insurance will cover me. I choose not to drive. I still have my driver's license. If there's an accident and your medical chart says that you have any kind of dementia, no insurance is going to cover you. So that fear, and my husband can drive. So what do? Somebody with cancer and somebody with dementia, we go to the store. But there's a dis-ease in us, both of us. We're not scared of this, but it's just an uncomfortable feeling now when you go out, when you breathe, when you touch things, and I don't know. What do you think, Elon? He's got little kids.
Well, in terms of taking young kids outside, is that what you're? We're taking them only for a walk around the block. Period. There's nothing more than that. We have a baby. We have a 5-year-old. All we do is in the backyard and walking around the block, and only one of us goes to the grocery store once in like 2 weeks. We don't do anything beyond that unless it's going to be emergency, obviously.
Which is smart. Lisa?
Yes.
I wanted to get your opinions on, if people should move or not, if they're in assisted living or independent living or memory care, and what your thoughts are on that. What have you heard? I know you and Kate are both really connected on the internet in social media groups and things.
When the Washington thing was taking off, I just thought, if that was my father, who just recently passed away, and we knew that he was going to need total care if he got out of the hospital. And I was up for that, believe it or not. And I also told him that we'd hire a nurse if he didn't want me, that we wouldn't go into a nursing home. And I think when there's something like this going on, that at some point they're going to die anyway. But I think if I had a loved one in an assisted living or a nursing home where it was running rampant, that's a death sentence. I'm causing their death because I'm letting them stay there. For me, it'd be more important to get them out of there, and then I hire a nurse, than it is for me to leave them there. And I know that's not the right answer, but to live with yourself, because that's the montage of my my YouTube channel, is to live life with no regrets, and I would regret it.
Yeah. And I don't think there's any right answer, Lisa, and again, some people might not have the funds to hire anybody to begin with. Others might have the funds, but can't find anybody to hire. True. I mean, because there's such a shortage too. And so until you really know some of those answers and can put those in place, or what if you get a staff person and you're like, okay, I've got this covered, and then all of a sudden the relationship doesn't work out.
Right.
Now, I mean, there's so many variables that can come into play with this, and that's the scary thing. I have one person in my memory cafe whose wife is in memory care, and he got her an iPod, and they plug it in, it's on a stand, and he can beam into her anytime. He says he turned the ringer off so it doesn't scare her, and he can just talk to her. And that seems to be working really well. It needed the staff to set that up for her, but it makes him feel much more secure and satisfied that he's doing everything he can without, because he knows he can't handle her back at home again. Because he probably waited too long to place her to begin with, but they've come up with this other mode. Now, again, not everyone can afford to go buy an iPad and is techie enough to instruct staff how to do it, but he and his son figured it all out and said, all you got to do is plug it in and set it up. And then he can just beam into her a few times a day and connect. Sometimes I think with these situations, it can be our guilt that's driving the change, but it may or may not be in the best interest of the person, because they could have increased anxieties from a move and from a change. And Deb, I'm just going to pull you in on what your thoughts are with what was just said.
Well, and it's like I said before, I think it is very personal. It can be guilt-driven, like you said, or it can be fear-driven. Some families feel like their mom or dad might be safer if they're living with them. But for a lot of the people, just being in their home and being where they're comfortable is what the priority is, and making sure that they're being well taken care of. It isn't always easy to bring someone home who requires care, and especially someone with Alzheimer's or dementia. It's very fearful for them to make those changes. Right now in our memory care, we're just keeping everything as normal as possible, and our tenants are doing wonderfully. I think it is a personal thing, but so there's no right or wrong. It's just that you got to sit down and answer all the questions before you make the decision.
Yeah, it's a deep. You have to go through a deep thought process, not just a reactive one.
Yep.
And
yep, absolutely.
And I think a lot of times we become reactive, because of our fear or because of our guilt. And sometimes we don't know all those questions. So then who do you go to? And that might be something that would be even good for the state or communities to say, if you're thinking about moving somebody out, here are the questions you need to really dive into, to make sure that this is going to go the way you think it's going to go once you're home. And then always remember, if possible, to include the person you're talking about in the decision, because they may say, some people might say, if it's my time, it's my time. Or I don't want to be that burden to my family. I don't want them to feel, the guilt. And then what if I die in their home? How's that going to go down? Now they've got me dying in their home. And what kind of effect is that going to have on them as a family as well? There's endless amounts of questions and things that have to be thought through. And I think honoring the person that we're caring for, not all the time, but sometimes can get sidetracked with what our emotional needs are to do the right thing. And
absolutely.
And so again, no judgment, but I do think it's a much bigger and deeper thought process to make this decision. And I think it's important to include those involved in it as well, so that you really have a good handle on capabilities. And I don't even know if at this time, Deb, it would be, a family would be able to have a conference call with, because you guys usually have quarterly assessments and meetings and things depending on, what level they're at. But even to get a care partner meeting together to discuss, okay, what truly are all their needs, and get that team really thinking about, okay, if they went out, what would they need, and how would you have to support them?
Right. And we have done that with a select few people who, for instance, some people who have spent every day long hours with their family member, and right now they can't do that with their tenant, with our tenants here. So we've had those conversations with those families and said, here's what it would look like if you thought about bringing them home. And they've made the decision that it's better for them to stay here where they're cared for and safe.
Mm-hmm. Okay.
So it's very, it's just like you said, there's just so many variables to it. And I think people have to sit down and ask themselves lots of questions and get those questions answered to know if they truly can handle what the needs might be if they bring their mom or dad home. There's a lot to that. And I know even from a personal standpoint, my mom lives here, and I thought, well, gosh, would it be easier for me to bring her home? But it wouldn't. She's in a very safe place. She's very comfortable. She knows her surroundings here, and if I move her out, that's just going to confuse her that much more. Even if she's by me, it's still going to confuse her too much. And so it's just better that she stay where she's safe and used to, comfortable with.
Well, and even when we were talking about the kids going to the grocery store, depending on who you have at home, can they stay alone for you to run to the grocery store if it's just going to be the two of you? Or now are you taking them out and maybe having to expose them in the public? I mean, the questions are endless, and I really appreciate everybody's time and thoughts on this. I'm just going to ask if anybody has any wrap up comments that they want to make. Deb, anything from you?
No, I think just I'm hoping everyone continues to really listen to what we're being told to do and take it seriously. There's too many people that I think are not realizing how serious this is. So listen to our governor and do what they're telling us to do, because that will flatten the curve. It will hopefully reduce the spread and keep us all safe.
Great. Thank you so much. We're having connection problems with Elon, and thanks for joining us. Kate, anything from you?
Yes. Deb, I've not met you, but I've heard about you through Lori, all the good things. And I just want to take this moment to thank you and your staff for doing such a good job at your care center, and keep it up. Take care of yourselves, and nobody. I mean, Lisa probably will agree with me about this. No one with dementia. Well, we still can think for ourselves, But I've never thought of this huge thing happening. How can I have questions and answers? Our world is smaller and smaller as we progress with the disease. So we don't ask about big questions. And I'm sure a lot of people are overwhelmed, even those with early onset. I can't say I'm overwhelmed, but I would say that if I have to choose right now between going to assisted living or staying here, let's say, I think I would be very, very confused. I wouldn't know what to say. I'll be totally lost, So this is a very big thing. So there's no, that what everyone says, there's no right or wrong answer, because we cannot plan for this. We did not plan for this.
Thank you, Kate. Lisa, how about you? Any last comments?
Yes, I would like to repeat. I think we should listen to our governors and do what we're told, and stay off the streets and stay at home. Only go out when you need to. We're starting to double in deaths a day, and so it would stop so much of that. I don't know if it's a nobody's going to tell me what to do kind of attitude, or I'm fine, it won't hurt me kind of attitude. But the thing is, it may not hurt you, but it'll hurt somebody else. And so everybody needs to stay at home, stay where you are. I don't like the term shelter in place. That reminds me of tornadoes, So, but ours governor says stay at home. He doesn't say shelter in place, but it just needs to happen. And people just relax. If nothing else, it has taken a lot of tension off of me, because my dad's house is 100 miles away, and I'm having to close it down to put it on the market. And now I can't. Well, shoot darn, I have to stay home. So it turned out to be kind of a blessing at the right time for me, in a way.
Yeah.
And so, and like I said earlier, and I didn't get to finish, but there's a lot of, I've noticed on Facebook, people putting music and popular songs and then putting in words about the virus and different kinds of jokes and different kinds of recording themselves playing all the parts of a piece of music and then putting it all together. Well, they got time on their hands and they're using it to entertain people. And I think that that's wonderful.
Well, to everyone listening and to all of our wonderful guests, thank you. Big thank you and prayers going out to all of our essential workers. And we will meet again next week. And if you're interested in being one of our guests, or reach out to us. I think it's important to continue to have these conversations and look for the bright things. What are the cool things that are happening, through all of this? I mean, everyone complains that they're too busy. Well, now we've got time. What are you going to do with it? What are you really going to make of that time? There are hobbies you can get involved with. There are volunteer positions you can do that you don't have to connect with people. You could write letters. You could make calls even to people. Get creative. How can you help? Stay safe and healthy, and don't forget to wash those hands. Bye now.
Hey everybody, Jared Sebestier, host of Retire Repurposed. This podcast is dedicated to help people transition into fulfilling and purposeful retirements. Retirement is a big life change. In fact, the two most dangerous years of a person's life are the year they were born and the year they retire. Few people could just flip the switch from working a career 30 or 40 plus years, retiring on Friday without methodical steps to living what we call a repurposed retirement. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.